Hello, everyone, and welcome to the 23rd Annual Striking a Balance Caregiver Conference, hosted by Age of Central Texas and the Area Agency on Aging of the Capital Area. I'm Bobby Meehan with Age of Central Texas, and we are a regional nonprofit organization that serves older adults and family caregivers. Striking a Balance Caregiver Conference is the largest, longest running free caregiver conference in Central Texas. Now, all this week, we bring you experts and resources to help guide you and empower you throughout your caregiving journey. Now, before we start today's presentation, I wanted to take care of a few housekeeping items. One, we are recording all of these sessions and we'll be posting them to the Age of Central Texas YouTube channel. So if you miss one or would like to watch a session again, or even share these resources with others, just go to the Age of Central Texas YouTube channel. As well, we'll be sending you these links at the end of the week that will include resources that you've learned, PowerPoint slides from each presentation, as well as a digital copy of the event program. And if you haven't done so, please add your first and last name to the chat so that we can take roll and know that you are here. As well, an ASL interpreter, we have two of them today, have joined us for these sessions. So to better view the interpreter, you may pin their window by clicking the blue square with the three little dots located in the upper right-hand corner of each interpreter's window. We're going to email you a survey after the session, so please complete this and other surveys that you might receive as soon as you can while the content's still fresh on your mind. Your input helps us to, one, plan future conferences, help other caregivers, as well as we can provide metrics to our grantors. So now I'm going to introduce my colleague, Shirley Trapani from Area Agency on Aging, and she's going to tell you a little bit about the survey that they're working on that we'd like everyone to do. Shirley?
Hi, thank you. As Bobby indicated, my name is Shirley Trapani, and I am a special projects manager here at the Area Agency on Aging. And in the chat window, we have already placed a copy of a survey, and this particular survey is the 2026 through 2028 Texas State Plan on Aging Needs Assessment Survey. And this survey is being conducted by the Health and Human Services Commission, and it gives us an opportunity to gather input from older adults, caregivers, service providers, and stakeholders in helping us to create a plan on aging, a state plan on aging that addresses needs and priorities of our aging population. And we're looking to discover what the needs are, the challenges faced by older adults and caregivers in Texas, and it helps us to guide allocations for resources and funding for aging services. And it also helps us improve and develop further programs that support healthy and independent living for older adults. And especially in this area, we're within the Central Texas region, where we provide services to 10 counties in this particular area. And this survey is being conducted, of course, on a statewide level, but we're very interested for the persons who have joined us today in completion of the survey. It'll help everyone greatly. And we thank you for your time. And thank you.
Shirley, thank you so much. Yep, and I'd just like to mention that Cap Metro is our sponsor of today's session. And now it's my pleasure to introduce to you Sienna Lindeman of Area Agency on Aging, who's going to get started with the panel presentation today. Sienna.
Yes, I'd like to thank you as the other partner for Striking a Balance. We have partnered for many years with Age of Central Texas, with the Area Agency on Aging and Aging and Disability Resource Center. We're very proud to support this opportunity for caregivers it's the toughest job in the world. And as Miss Rosalind Carter said, almost everyone that you ever meet, you're either have been a caregiver, or you have been cared for, or you're going to be a caregiver. So this is a real exciting opportunity. It's wonderful to see over 40 people coming to this session. And I'd like to give a particular shout out to our Aging Services Council members, as well as our Aging and Disability Resource Center Steering Committee members, who are also using this as part of their training. If you're interested in either group, you can certainly chat me about those things. I'm not going to go too much more into what an area agency on aging, or ADRC, does, because I'm going to get to present that in a few moments, my colleague Monica and I. So thank you again for attending.
Hi, everyone. My name is Sarah Evans. I work with United Way for Greater Austin as their Community Resource and Engagement Manager. We wanted to give you an overview of the agenda just so you can kind of get an idea of what we're going to talk about today. We'll start out by introducing ourselves, all the people who are going to talk today. It was on a previous slide, but it's more fun when it comes from us. And then we're going to talk about what is INR. INR stands for Information and Referral Services, and you'll see that a lot. We'll kind of go into a little bit more. Then we're going to talk about why you might want to use INR services, and then we'll talk about how to use INR services. All of the agencies that are presenting today offer INR services in one way or another. So we're going to talk about who to contact. Some ways we're the same and some ways we're different. And then we're going to give some example scenarios. We're going to do kind of some mock calls so that y'all can know what to expect. And then there will be a time at the end for Q&A. During our presentation, if you want to add questions in the chat, feel free. I know sometimes I think of a question and then forget it unless I write it down immediately. So yeah, put those in the chat. We'll make sure that they are addressed at the end, but we'll go ahead and get started if we want to go to the next slide. Oh, actually, let's introduce ourselves. Sorry. I'll popcorn Ashley.
Yeah, hi everybody. I'm Ashley. I also work for United Way for Greater Austin. I'm one of the community resource and engagement specialists. So I do a lot of work with nonprofits in the area, keeping information up to date within our system. And yeah, Sarah and I will get into all of that good stuff later, but yeah, happy to be here. And I will pass it over to Monica.
Good afternoon, everyone. Thank you, Ashley. My name is Monica Hale, and I'm with the Capital Area Council of Governments, and I work specifically in the Aging and Disability Resource Center as an information referral and assistance navigator. And now I will popcorn it over to Miss Susie Drum.
Susie, for some reason we can't hear you. But you're not muted. So while you play with that, I'm gonna go ahead and do myself.
Okay.
While Susie checks her audio. My name's Bonnie. I work at Age of Central Texas with Miss Susie. I'm the program director for information and resources and for the health equipment lending program. So cover a lot of different things. So that would be me. And I think Sienna's given a little bit of introduction. So I see Susie is still having an issue. So I'll let y'all know about Susie. We stole Susie from the council area of government, the Capital Area Council of Government. She's an IR specialist, and now she's come to work at Age of Central Texas, and we're thrilled to have her.
And while we're waiting for Susie, I just wanted to remind everybody that for the chat, put your first and last name in the chat, but then there's a Q&A function at the bottom of your screen. And put your questions into the Q&A, please.
So I think my introduction for Susie will be okay, and we can move on to the next slide, and I will talk a little bit about INR services. Susie, can we hear you yet? Not sure what's happened with Susie's audio, which was working just fine 5 minutes ago. So we'll get that figured out in time for her next present part. So information and referral services, INR services, you'll hear it being called. Some people, we refer it to information and resource navigation. It's all sort of the same thing. We're connecting people in the community to the services that might best meet their needs. So it could be all sorts of resources and information. It could be things pertaining to childcare, adult daycare, housing resources, rent and utility assistance. You might reach out to INR services for things like rental assistance, utility assistance. If you have a question or you have a need and you don't know how to get support, you can reach out to an INR service for some direction or connection. It could be that an organization's primary service is INR, information and referrals, or information and resources, or it could be another program that is a part of a larger organization's menus of programs to support the community. So you have those two different models. That's pretty common here. Next slide.
So why use an INR service? And it can be a bit tricky trying to navigate all the different types of resources that there are. There are lots of services available. It can get overwhelming to navigate. But just so that you know, most organizations personally vet the resource information with the associated organizations that we're referring to. We want to ensure that the information is accurate and as up to date as possible. Once we know specific needs of a client, we can better help pinpoint them in the right direction. And it can kind of help save a little bit of time sometimes. And it also helps you there may be some resources you don't know about that may be available that meet your specific needs. So that's just a few of the reasons why you may want to use an INR service. We provide individuals with information on eligibility that may be required, and that way they know what to expect before they reach out to an organization. And we try to get all the details that we can about the organizations. We don't always have all the specific requirements, but we do our best.
All right, and I'm going to be talking about how to use an INR service. So it's really going to vary between INR providers, and we'll kind of get more in depth with that later as you kind of learn about each of our processes. For some INR services, it's best to call, visit in person, or visit via website. Some also provide one-on-one consultations by telephone, online or in person. So really just about what's going to be best for that INR service as well as the community. It is very important when you're speaking with somebody that offers INR services to let them know where you're located, so that way they can be able to look up resources within either your zip code or just general location. Also very important to note that you're able to give them as much information as you feel comfortable. So we do understand that there's some situations that are, very sensitive, and you might not feel comfortable sharing all of this information with an INR service navigator. That is totally fine. I think that should be up to your discretion as well. So only share as much information as you feel comfortable with. And then very lastly, important to note too, that they're going to be giving you referrals and not direct services. So it's going to be information about how to contact those services as well as how to access those services.
So Age of Central Texas, it is a long-standing organization that started way back in 1986 as a collaboration of entities, organizations that were committed to serving older adults and caregivers. And what we really want to make sure is that people in our community, older adults and caregivers, are thriving while they're navigating the challenges, opportunities related to aging and caregiving. And that can look in a lot of different ways. We have this vision of society where aging is a shared journey that's marked by connection and strength and vitality. And we know that the role of caregiving is supported through community, collaboration, and guidance. That's what our great hope is. So here at Age of Central Texas, we really value collaboration. That's one of the things that I was thrilled to come to this organization, was because of the collaboration. And collaboration in INR means that we have a lot of different relationships with folks, entities, organizations, nonprofits, and for-profits that can provide services to support older adults and caregivers. So going on to the next slide. We do this, we provide supports for older adults and caregivers through a number of different programs, and they're listed there. I'm just going to briefly give you the one-sentence introduction for each one, but the Thrive Social and Wellness Centers are our licensed adult day centers. We call them a health service center. We offer specialized care for individuals living with cognitive change or physical changes due to aging. Our Memory Connections program is a comprehensive online program for older adults experiencing mild or early stage cognitive changes, helping participants to take a real proactive approach to maintaining their quality of life while providing social connections and support and daily online activities. Our health equipment lending program, we take in durable medical equipment, whether it's gently used or new equipment that people donate to us, and incontinence supplies, and then we give those back out to the community. We make sure that they're safe and clean and ready to go, and we give them back out. Our Caregiver U program is our education arm. So we have 4 evidence-based courses to support older adults and caregivers, and 3 research-based classes that we offer through community partners out in the community over 5 counties. And then we have our Tech Learning Lab, where we share resources and information about technology so that we can help adults thrive while they're navigating the tech in our world, whether that's your Apple phone or, an assistive device. And then INR, which is what we're here talking about today. So we can go on to the next slide. So we have 3 locations. They're listed there to serve folks. We have our Alice May new South Austin location, and we're excited about that. We also offer INR services in Georgetown on Tuesdays. Right now, we're just doing that as a pilot on Tuesday mornings, and then our Central Austin location is our main location. We know that as people age, they want to age in place, and that requires support from the community. So through our INR services, we're connecting older adults and caregivers to those supportive services, both nonprofit and for-profit entities. We want to make sure that you're supported on your journey. You can go to the next slide, please. So some of those key features, and I'm just going to pull up my last slide here, is that we offer individualized consultations in person, by telephone, or online, so we can schedule appointments with clients. We also do follow-up encounters. So that means that after you have a consultation with us, whether that's a phone call or in person, you're going to get another phone call or reach out by email where we check in to make sure that things are going all right. Do you need other resources? We also offer seminars and conferences to get you connected to information as well. Next slide.
So at this time, I'll give a little introduction about our Capital Area Council of Governments. Most of us that are on the call here today, we work in the aging department. So that's going to be the AAA. When you hear AAA, we're referring to the Area Agency on Aging, or you'll hear ADRC, which is the Aging and Disability Resource Center. But I did want to let people know, in case you're not familiar, Capital Area Council of Governments, we do have other departments as well, and I just wanted to touch very briefly on those. And our mission for the CAPGOG is we help advocate, plan, and coordinate regional services using the following departments. So we're all from the Aging Department, but we also have Emergency Communications, which includes the 911 Center. We have Homeland Security. We have law enforcement training, solid waste reduction, and transportation planning, just to name a few. I know that before I came to work here, I had no idea of all the different areas that CAPGOG entailed. So I just came here and interviewed for the navigator position and learned about aging. And then when I got here, I was like, oh, wow, okay, there's a lot more going on as far as the region goes. So I just wanted to kind of touch base on that very quickly for you. Here in the Area Agency on Aging and the ADRC, we do give quarterly workshops for caregivers and helping professionals. We do that. We just had one in July, towards the end of July. And so our next one will be in October. We usually hold them the last Friday of the month, but you're always welcome to reach out if you're interested or you think that might be something you want to attend. And it's similar to what we're doing today. We're doing a little bit more condensed version, but at those workshops, we actually have people from each department come and kind of share with the caregivers all the different resources that are available to them. And so we can go on to the next slide, please. So included in our 10 regions for the Capital Area Council of Governments, you can see the map here, but we serve Bastrop, Blanco, Caldwell, Fayette, Hayes, Lee, Llano, Travis, and Williamson. I think they left off Burnett on here, but also Burnett County as well. And then also I did want to mention as well that we have a health and wellness classes that are requested. We do try to travel and do our workshops throughout the region, so we don't just always stay in Travis County or Williamson County, but we do travel throughout the 10-county area to hold the workshops. And then we do get requests for some of our health and wellness classes that we offer as well. The coordinator for that is Ms. Rhonda Thompson. And some of the classes that we offer are matter of balance classes, diabetes management, chronic pain, chronic conditions, and building better caregivers. So those are some of the classes that we offer as well. Going to the next slide, please. So our mission here at the Area Agency on Aging of the Capital Area provides quality services to support and advocate for the health, safety, and well-being of older individuals in the region. We know that many of you that are on our call today, you either know someone that's 60 years of age or older, or there may be someone in the home with disabilities. So we like to offer resources for them, and we're counting on you to help spread the word about the resources that we offer. So that's why we wanted to kind of include our mission. And then our next slide, please. Wanted to touch a little bit about how we're funded. The Area Agency on Aging of the Capital Area, we're funded through the Federal Older Americans Act. You can see our mission statement has been repeated there again. And then we felt like it was important for you to also know that Area Agencies on Aging serve all areas of the country, including all states and territories. So you can find this when you're traveling across the USA, you decide to move or relocate. The first thing you want to do is maybe look for your Area Agency on Aging or Aging and Disability Resource Center. to kind of help you with resources and kind of learn more about the area. So that's kind of good to know as well. And now I'll turn it over to Ms. Lindeman. She's our Assistant Director for Program Implementation.
So, well, you've already got a great kickoff there from Monica. So, but I'm going to tell you a little bit more about area agencies on aging. As Monica mentioned, we are your tax dollars coming back to serve you when caregivers need it. We sometimes get asked, oh, you know, we don't want to take this assistance and we might take it from somebody else. And I like to ask everyone in the room, how many of you have paid taxes? Well, that usually ends up being just about everybody. This is the time that this funding comes back to you from the Area Agency on Aging to caregivers and older adults when they need it. Because we're federally funded and a government-supported agency, though, some of our programs, particularly some of what we call our direct service programs, are restricted in by the Older Americans Act. So when Congress passes that funding, and as they've done ever since 1965, there are some specific criteria to ensure that that money and the funding is going to serve older adults and caregivers. And you see those on your slide in front of you. So for example, the majority of care coordination or our nutrition program is for persons older, 60 years of age or older. The same thing applies for some of our caregiver support programs. For some of the direct service that might be available, the person either needs to be age 60 and above, or they need to be caring for someone who's age 60 above. But you'll also see that due to grassroots advocacy here, and I want to let you know that, sometimes we are able to assist people that are a little bit younger. So for example, one of the programs we get asked about is, what if I'm a grandparent and I'm 55 and above, and all of a sudden I end up taking care of my grandchildren full-time, the parent's gone, there's no support from them. Those programs, the caregiver support is also available to older adults, not just grandparents, aunt, a great aunt, you know, that kind of thing, who are raising children under 18. In addition, we also talk with people who are 55 and above and may be caring for an adult child or a child of that has a significant disability and are now at their older age, perhaps struggling a little bit to care for that individual. So that's what you're seeing there on the slides, is it's always worth a call to check, because we want people to know about our services, but we do sometimes have some very strict requirements related to some of the direct service that we offer. So next slide. So this slide gives you a good idea of, throughout the country, what all area agencies on aging offer as their core programs. And you'll see in that bright green one, the pine green one, the information referral and assistance. So if your mother or your sister is living in Maine or in Tucson, Arizona, they can also access information referral that's specific to their area. And I saw a question, for example, about our counties. It is true that we are most familiar in our information referral with the 10 counties that we serve as your area agency on aging. However, if people do call about relatives outside our county, we can refer them to another area agency on aging, and we'll look that up for them, of course, so that they can get the most correct information from the people who know that region best, the area agency on aging in Dallas or Maine or wherever. The next service I want to just mention that all area agencies on aging know, this is the one you actually know about, but you probably don't know it's from area agencies on aging. If you've ever heard of home delivered meals or free meals at a senior center or a free lunch for seniors, that is actually that funding, not all of it. Some of it has to be raised locally by the nonprofits that we contract with to deliver, but a lot of the funding comes from the Older Americans Act nutrition money, and that's funneled through our office. So that is a very common question about how can we get a home delivered meals? And it's our job to link you to that, but it's also our job of the people down the hall from us in our nutrition program to make sure that money is available for those meals. We also have Medicare benefit counseling. I do want to be specific here. We provide some guidance at the Aging and Disability Resource Center about Medicaid. Texas Medicaid is completely separate from Medicare. Throughout the United States, all area agencies on aging provide information on Medicare. That's the national, as you know, federally supported health insurance program for older adults, generally over 65, or people who are getting SSI or SSDI and have a disability. Our wonderful Medicare benefit counselors are certified by the state. They're not insurance agents. Their job is to provide a neutral and helpful, help people choose what's the best plan for them. They get very busy during Medicare open enrollment, which is coming up October 15th to December 7th. And part of our information and referral is screening all our callers to find out if that would be a helpful service for them. Care coordination and caregiver support, I've kind of touched on. That's our most direct personalized service for persons, generally speaking, who are without Medicaid, but still have a very low income and might need very short-term in-home help or caregiver respite. The care coordination and caregiver support programs support that. We also are the folks who visit the nursing facilities. That's the ombudsman program. Our ombudsmen are literally on the road in our 10 counties, well, not 24/7, but 5 days a week, visiting and advocating for the residents and the family members in both skilled nursing as well as assisted living. And lastly, it's great if you have an advocate as an ombudsman if you are in a skilled nursing facility, but as I like to mention, it's even better if you don't break your hip and end up in the facility. So that's what our health and wellness education does. We do some of the similar classes that Age mentioned. We're partners in doing some of these work classes, things like matter of balance falls prevention, or managing chronic disease or chronic pain. Those are all free to anyone age 60 and above, and sometimes their spouse can come along too, even if they're maybe a little bit younger. So those are some of the core programs that all area agencies on aging offer, and the IRNA is the front door, next slide, by which people actually end up with those services. So our staff here who are in IRNA answer over about, usually we get about 30 voicemails a day because we just have a very limited staff. It usually is a voicemail. Unfortunately, it's not always a live call, but we answer every call, and then we talk one-on-one with each person. Every situation is unique. The questions people have are unique, and then we link them with whether it's an area agency on aging service or whether it's another helping agency. We do tend, as a government agency, to focus primarily on nonprofits and other government services. Since we are government, we can't pick or choose which is a best for-profit, so we don't have lists, for example, of in-home care providers. But it is our role to help people understand the system of getting help, whether it's long-term or short-term. And there, right there, you can see the main access number and email, because we also respond to emails. We love email. People don't need to put in a lot of private or confidential information, just knowing what the problem is, and then we'll call people back and that information gets handled that way. So this shows you a little bit more about those care coordinator services. A lot of people do call our information and referral for information about those. You will notice that the primary is somebody who is in need of either personal assistance or homemaker services. A lot of people, and I know I was one of them, and I know my kids certainly believe this, believe that Medicare is actually going to pay for someone to come in and bathe and wash their mom, or to cook a meal for her or keep her house tidy. In reality, Medicare does not pay for that. That is either Texas Medicaid for long-term care or for short-term. Sometimes care coordination has the funding available to do that locally and on a short-term basis. So that's a little bit about doing our intake for that when our information referral specialists work with you. Next slide. All right, this is a little more about what the long-term care ombudsman program does. We do know that people need this service. A lot of people want to advocate for their loved one who is in a facility. And this is essentially, we are not regulatory. If it's anything directly that is related to safety, serious safety issues, the ombudsman can help connect the family or the resident to regulatory. But what we do primarily is advocate for the resident and help them mediate sometimes, say, with an administrator. So next slide, please. So for example, if somebody wants to take their shower in the morning and not at night, that's the kind of thing that our ombudsman can help them advocate for. All of it is completely confidential and nothing is ever raised in terms of an issue without specifically the resident's permission. So, next slide. And this is how people can reach it directly. We know that sometimes they do call our main information and referral line for this service, but it actually is wonderful if you can just reach out directly to ombudsman when needed, because they have their own separate phone line and it's its own service. So that's their contact information. Right. And lastly, we actually have a separate information and referral line, although we have one team of people working on this, for aging and disability resource centers. The focus of the ADRC is slightly different from the Area Agency on Aging, and that has to do with the D, as in disability. So we specifically exist as an ADRC to help guide people who are caregivers for people of any age or people who have disabilities themselves about resources, again, throughout the region. The ADRC really does not have many direct service at all. It's a little different from the Area Agency on Aging in that sense. So primarily it's there to provide guidance and support to families and consumers related to how to access long-term care. Next slide. This is probably our most common question, although we also do lots of other types of referrals, whether it's for transportation or home delivered meals or for respite care for parents who have children with special needs. But one of the most common questions we get is about how do I get long-term in-home care for my loved one? And so that's why we include this slide. This is, like I said, one of our most common information and referral questions. We're always happy to guide families related to this information. We have a resource database that our navigators use of over 500 resources throughout our counties that focus on older adults and people with disabilities and their caregivers. And so that's a little bit of how we might differ a little bit about than 211, which you're going to hear from momentarily. Any questions for us? I generally like to address any question that came up during this part of the presentation, just because this is when it's in your head. So
Sienna, I can tell you, there was a question asked about how do you specifically let the client know that these are resources and not direct services, as this is a frequent occurrence and request from many who are referred to us. And I'm not sure who Alita is with, but I'm assuming she's with an organization that we might make a referral to. So when a person contacts you or contacts AAA or the ADRC for resources, how do you let them know that it's a referral, it's a resource, not a direct service?
We try to emphasize that by doing presentations and outreach on a routine basis, explaining that information and referral is just that. Alita actually, full disclosure, because you'll all meet her soon, Alita works here. And I think that what she's referring to is that many people who call us on our information and referral line believe that they will get a ride from an area agency on aging, or that will get immediately a home delivered meal from the ADRC. And so we do try to put that message out both on our website and in our outreach materials, but she's right, it's not always clear. We also are always helping, we have a lot of ways we network with. Many of the people I see on this call are what we call helping professionals. And we provide this information to you as helping professionals, but we generally don't call clients on the behalf of, say, somebody from a managed care organization, because we don't know the client and the client doesn't know us, and they should be skeptical of answering the phone with a stranger and giving out personal information and things like that. So we are always happy to provide guidance to helping professionals that, particularly it's a little bit quicker to email us. But we don't call clients on other people's behalf just in general, because it's not a very safe practice for that client. And we are really emphasize fraud prevention, right? So we need to put our money where our mouth is in that. I hope I answered the question well. We're very clear with consumers when we make a referral that we do not always know if the agency can or will help. And because we have an integrated database that can be updated, when something is closed, like rental assistance from an organization is no longer available, we don't refer our clients to that agency if we can possibly help it or if we're aware of it. So that's a little bit, I hope, on that question. Great question.
Thank you. I think that was a good answer. We can move on to the next slide.
All right, everybody, I'm going to tell you a little bit about United Way for Greater Austin. United Way for Greater Austin is a nonprofit with locations in Travis and Williamson County. Our mission is to bring our community together to break economic barriers and build an opportunity for all. We hope to see a Central Texas where everybody has the opportunity to thrive. And one of the main ways that we do that is with our Community Health Resource and Navigation Center. We offer information and referral services for a 10-county region via the 211 call line. And so what you do is you call 211 and then you're going to have a couple options. We are option 1. Option 2 is Health and Human Services. Option 3 is the Inspector General, I believe, something like that. So it's important that you go to option 1. We have a lot of people who click the wrong option, but you'll select option 1. And then you'll get to a call specialist that can help you find resources for your needs. And then also we have an online resource database called connectatx.org that you'll get to see later on. But we like to provide a couple options. Some people prefer to call and hear someone's voice. Some people don't have time to make a phone call, don't feel comfortable using the phone. And so we do have an online option as well. And we focus on free and low cost services that span all aspects of health and human services. So while we do have resources for older adults and their caregivers, those could be anything from looking for low cost pet food in your area, to looking for a ride, really anything you can think of. We'll look for that in your area. It doesn't necessarily mean that there is that resource available in your area, but we work with about 910 nonprofits that offer over 4,000 services to our 10-county area. And a little fun fact, we're celebrating 100 years this year. So this is our centennial year. Very exciting that we've been able to be out in the community and serve for 100 years. The next slide that we're going to talk about, I'll start it off. But all of the three agencies that you've heard from today are kind of going to chime in about how to reach out to us. The important thing to know is that there's no wrong option on who to contact. We will get you where you need to go. And we all work, as you can see, very closely with each other. So we will get you the information that you need. We may even work in conjunction together to get you what you need. So some of the main differences between us are obviously how you get in contact with us. So the phone number, the email, some of us prefer to, or some of us meet in person, some of us don't. And then some difference between our coverage area, what we focus on, and then when we're open. So I'll start out with United Way and then pass it over to Age, and then we'll finish with AAA and our Capital Area Council on Governments. So United Way, to get in contact with us, you call 211 option 1, and you can call on your phone from anywhere in the state of Texas. Also, if you have loved ones that don't live in Texas, most states have a 211 as well that offer the same service. And you will be able to select the language that you prefer and get help that way. And then I also mentioned that you can visit connectatx.org. We also have a translation service through that website as well. We cover a 10-county area: Bastrop, Blanco, Burnett, Caldwell, Fayette, Lee, Llano, Travis, and Williamson counties. And then, like I said earlier, we focus on free and low cost referrals and information on all kinds of services. And then we are available 24/7 with a multi-language line. So you can call us at any time. I tend to tell people, if you wake up in the middle of the night, can't sleep because you're worried about getting your rent paid, call 211. Somebody will answer and help problem solve with you. So that is United Way and how to contact us. I'm going to pass it over to H.
Yeah, so for us, we have a direct phone number that gets you to the Information and Resource Center. Of course, there are other numbers for all the other programs that I mentioned earlier, but our direct number for resources and information is 512-600-9275, or you can email us. Our goal is always to get back to you. If you reach us and have to leave a voicemail, our goal is to get back to you within 48 business hours. That's our goal on paper. Our goal in reality is 24 business hours. So that's what we're striving to do. We're available Monday to Friday, typically from 9 a.m. to 5 p.m. And we do have the availability of language lines. So if you need services in a different language, if you can communicate that with us, we can use language line to make sure to provide those services to you as well. And we just wanted to let you know one other thing. Susie is joining me here beside us with technical difficulty solved by having her beside me. So go ahead.
So in addition to this, I just want to let you know that there is no eligibility requirements. Income is not considered, and or age to qualify.
Yeah, so we can help anybody.
So if you need information and resources, you know who to call.
Thank you. And now we'll move on to the.
So I'll just mention that we also do have language line also, and then I'm going to let Monica speak to the rest of this slide and add anything in about the Aging and Disability Resource Center that she would like to cover.
I think you all saw that we kind of put our contact information up after each section. But really, it's kind of similar. If you call the wrong number, they'll get you to the right department. If you leave your voicemail or information, they'll redirect. We do a lot of redirecting actually around here. So we'll redirect the call to the correct line and email and correct department. You can see there on the screens. And I wanted the question that Alita had about how do we let them know that we're only information and referral. Actually, I probably have that conversation at least 4 or 5 times a day because they're just not aware. And it's even before I started working here, I wasn't very aware of a lot of the intricacies that go on with the information and referral. So a lot of times I will just start the call by letting them know we are information and referral service. We did mention this, but the ADRC does have the direct service we do have is Austin Energy. So if you know anyone that has Austin Energy utility service and they're 60 or above, or someone lives in the home that's 60 or above, or someone that lives in the home with a disability, then we can help them with the +1 program. There's a lot of different +1 partners, but we are one of them. And that is one of the few direct services that we do offer. So I just wanted to mention that because I don't think we mentioned that.
Thank you, Monica. Thank you very much.
Sienna, if you'd like, I guess we could jump right in and start our mock
We'll
call.
jump into the mock call. I do want to mention, though, that if any of you have specific perhaps resource questions that you'd like us to use for the mock call or address, we're not going to be able to do real information referral, and we want to protect everybody's privacy. So we wouldn't want you to share an actual, names or anything like that. But we're going to go ahead and do a mock call, I think, right, for the Aging and Disability Resource Center, just as if we were talking with the person right now. And we'll just go ahead and hit it. And I believe Monica has a concern, and I'm going to be wearing my navigator hat today. So, hi, this is the Aging and Disability Resource Center of the Capital Area. How can we help you today?
Good afternoon. My name is Miss Daisy May, and I just had a quick question about I care for my aunt who's elderly, and I've actually been doing it for a while, but I was told there might be a program where I could actually be paid for being her caregiver. So I just wanted to call and get some information about that.
So, well, terrific. May I call you Miss Daisy May?
Yes, you certainly can.
All right. Well, Miss Daisy May, again, my name is Sienna. I'm with what's called the Aging and Disability Resource Center, and I'm happy to help provide you some guidance related to that very thing. First, I'd like to mention that clearly your aunt is real blessed to have you as her caregiver. It's a tough job.
Yes, it certainly is. And I actually had to leave my job to stay home and start caring for her. So that's why I was very interested in your program about possibly getting paid as a caregiver.
So it's not a program of the ADRC, but it's absolutely our job to help guide you about it. I am going to ask you, Miss Daisy May, for a little bit of some information, nothing real private or confidential, that's going to help me to make sure I connect you with the right resources, because that's what we are. We're primarily information and referral services. I also want to let you know, Miss Daisy May, if you like, that we can email everything we talk about to you. You don't need to write little numbers down by the telephone or anything like that. I know that can be quite overwhelming to talk about these complicated resources. Would you like me to do that for you today?
Yes, that would be great. I appreciate that very much. I do want to say, though, we live kind of outside of the Travis County area. We're actually in Llano. Do you know about resources in the Llano area?
We absolutely do. We serve the 10 counties all around Llano, and I'm actually going to also give you some, or I can share some resources that are very local to you that might know even more. So let me just get your zip code, if you don't mind. Do you live with your aunt?
Yes, I do. And our zip code is 78643.
Right. Okay, and I see from my database that it lets us know that you live right in Llano, the city of Llano, right?
Yes, ma'am.
Okay, all right, well, thanks. And let me just check a couple things that again will kind of help us understand. Is your aunt age 60 and above?
Yes, she's 71.
All right, and did she have, if you don't mind me asking, and you don't have to go into a lot of personal details, does she have a disability?
Um, yes, I am having to help her. Yes, with some things around the home and so forth. Yes.
Okay. And did your aunt serve in the military, or is she perhaps the widow of someone who did?
Well, actually, she was a nurse. She did serve in the military, and she was a nurse during the Korean War.
Well, I am sure that you are super, super proud of her, and I thank her for her service. I'm gonna let you know that I'm kind of excited about your answer to that question too, because there is a program from the VA that's actually, she may be eligible for called Aid in Attendance. I'm gonna link you to your veteran service officer in Llano. You don't have to write this down because it'll be in your email. So we will be letting you know about that, but I want to mention it right off the bat because that can be a big support to her and to you in this care. All right, and then the last question is, or last kind of information question is she currently on both Medicare
You
and
mean,
Medicaid
like,
or just
Some
Medicare?
extra paper or?
I believe she gets Medicare. I don't know too much about the Medicaid program, but she does get Medicare, which I understand is
Okay,
mainly
so you
health
want it
insurance.
perhaps at your
If you're
table,
not
your
presenting,
bed.
maybe you'd like to mute yourself? So, alrighty, so moving on. All right, so let me let you know a little bit about your basic question, which is about being paid as a caregiver. And again, this will be sent to you in an email. Just so you're aware, normally Medicare does not pay for in-home services of the kind that you're probably already providing for your aunt. And you probably know that if you've already asked them about that, her health insurance. Bathing, dressing, grooming, and so forth. The only way long-term, and not counting the veteran program we talked about with is 8 and 10s, to have that funded is by what's called one of the Texas Medicaid programs. And so the first step for you and your aunt would be to apply for Medicaid and ask them specifically about the Community Attendant Service Program. Then you'd go from there. And if they approve the in-home services, you can ask Medicaid to be paid as the in-home provider. So it's kind of a three-step. Apply for Medicaid, get approved for in-home services from Texas Medicaid, and then ask to be the paid provider. There's some other programs, and I'll put them in my email, that if she gets denied for what I call complete Medicaid, might be of support to you. The other thing I want to check up on, and because I want to wind this particular call up, give others the opportunity, is what other services might you be interested in? For example, would you be interested in home delivered meals, or what other things might she need?
Yes, that would be great. Home delivered meals, transportation. And then I did have one other quick question. Can you actually help me with that process of applying for Medicaid?
Well, we're going to send you the links that you can apply directly online, as well as the main phone number. We're also going to suggest 2 or 3 agencies that are what are called benefits enrollment centers. Unfortunately, we don't have the staffing and the funding to do that, but the benefit enrollment centers for Prosper and the Central Texas Food Bank do, and that'll all be in your email for you. So I'll also put in information on carts and the home delivered meals in your region, and the Llano Community Resource Center, which might know other local resources in your community. So you should look for that from the ADRC at capcog.org in your inbox. And anything else I can help you with today, Miss Daisy May?
No, that's really great. I appreciate the information. I didn't know a lot about that. Um, and I've never worked with the veterans program, but someone did mention to me about aid and attendance through the veterans program, but we've never looked into that either. So I do appreciate all your help today.
You're very welcome. It's been a pleasure, and you can reach back out when you see that email if you have further questions. Take care, Miss Daisy May.
Thank you.
That was really awesome. Thank you so much for that mock call. I'm going to invite Ashley and Sarah to show us a little bit about, like, to move to their version of the mock call and show us Connect ATX.
Yeah, I know we're like right at 2. I didn't know, were we gonna stop here for questions or we're still good on time?
2:05, we'll stop for Q&A.
Okay.
So we've got
Okay,
we've got a little bit of squishy room.
Awesome. Okay, well, let me go ahead and hop right into it then. So this is the Connect ATX website that Sarah had mentioned earlier. So for whatever reason, if individuals, if they don't want to call 211, they're more than happy to, or more than welcome to go on the website and search for resources. So since we're kind of short on time, I'm just gonna go ahead and walk y'all through. So first, you're going to start with a zip code. So we can
Actually,
do,
we can't see the Connect ATX page.
you can't,
Mhm.
okay. Let me stop sharing and reshare again. Thank you for that. What about now? Y'all see
Yep,
that now?
I can see it. Perfect. Thank you.
Awesome. Thank you. Okay. So this is the main page of the Connect ATX site. You're always going to want to start your search with a zip code. So whether you're searching for yourself, maybe family members, we're going to go ahead and input just a generic Austin zip code for today's purposes and click search to kind of get into like the main frame of Connect ATX. And you'll see here up at the very top, there's a lot of different categories. And as I hover over each one, some subcategories that pop up. So as Sarah mentioned, lots of different resources, not just caregiver resources that you can be able to search for on the Connect ATX page. This is that language feature tool that Sarah had mentioned. So if somebody, their preferred language is not English, they can actually be able to translate this entire web page into up to 200 languages. It is done through Google Translate, so it's not perfect by any means, but that is an option. And then we'll go ahead and look up, for today's purposes, some adult day centers. So I'm going to go ahead and search this here. And again, we're searching in the 78704 zip code. So you'll see here, oh, I already have my filters on. Sorry. Let me put these or get rid of them. So you'll see that there was about 7 search results that came up in the 78704 zip code. There are some personal filters up at the top. So if maybe your mom is dealing with Alzheimer's, you can go ahead and input that here to be able to filter the search to kind of help narrow down the search results. Sometimes it can be really overwhelming just scrolling through a list of resources. And you'll see here, it already narrowed it down to 2. And we got our age, Thrive Social and Wellness Center, which is awesome. You'll also see program filters. So this is going to be more specific to the services themselves. So if your mom, if she can only go to adult day centers, either open now or early, these filters will appear here, and you can be able to filter the search results that way. Also wanted to highlight up at the top, you can search by relevance or closest. So important if you're wanting to find something that's really close to home, especially for your mom, if she is wanting something really close by, that's also something to be aware of when you're searching. And then showing you what the actual resources look like. So this is what we call a program card. You can click on more information to kind of get a more robust overview. I like to highlight this print view feature. So maybe your mom or the person that you're caretaking for would like a tangible copy of this resource. You can be able to print it out. And then let me go back here. You can also be able to share this resource. So if you would like to send it to anybody via email or via text, you can be able to do that here. You'll see that it has the option to send in their preferred language as well. So we really want to try to make this as accessible as possible. I know we're like right at 2:05. Wanted to see if there was anything else I wanted to share. Oh, last thing, very last thing. This big green button you'll see is going to show you next steps of how to get in contact with that organization. And every resource on our webpage, everybody's going to have a different process of that. But it just so happens that AGE is accepting referrals through the platform. So this is where you would be able to send either for yourself or family, or if you're referring somebody else, be able to send that individual's information directly to AGE. And most importantly, making sure that you have that individual's consent, because you're going to be sending just basic information like their first, last name, best way to reach them, and things like that. But yeah, I know that was a quick overview. Any questions about Connect ATX as a whole?
I am not seeing any Q&As in the chat right now
Okay,
regarding Connect ATX.
awesome. Well, I'll go ahead. I'll stop sharing. I'll pass it back to you, Bonnie.
Super. Hey, friends, I just want to let you know that this has been a lot of information from a lot of folks in a very short time. It probably felt like you were drinking from a fire hose. So if you have any questions, please go ahead, take a second and put them in the Q&A. I also wanted to let you know that we are working together collaboratively, as I mentioned earlier, to provide educational seminars and webinars and all kinds of conferences that really meet the needs of our community. And so to that end, I've put a survey in the chat. So if you would just take a second to fill that out, you can click on it and it'll open up behind your Zoom, or if you have multiple screens, I'll also email this out to you. It would really be helpful to have your feedback so that we can provide the resources and information and educational events that serves you best. I also wanted to take a quick second and let you know that this presentation and the other 4 or 3 that have been on this week will show up on AGE's YouTube site. Probably sometime next week once the videos have been processed. And at the end of the conference, I will be sending out an email with all of the PowerPoint presentations, and if folks in previous conferences have shared resources. For example, yesterday there was an editable PDF document for caregivers that will be in that packet of information that you'll receive by email as well. So with all of that being said, I'm going to just double check and see if there are any more questions, and there are not. So I am going to pass it over to Bobby.
All right, thanks, Bonnie. Just wanted to thank again Cat Metro for sponsoring today's session, and also want to thank all of our panelists, Sienna Lindeman, Monica Hale, Ashley Atwood, Sarah Evans, Susie Drum, and Bonnie Howe for the really fantastic presentation and discussion, and the mock calls were just brilliant. And so thanks for that. And most of all, I want to thank everyone who's attended today. This is our final virtual session for this 23rd annual Striking a Balance Caregiver Conference. Now, there's still time to register for Saturday's live event. It'll be a great time for that in-person, one-on-one opportunity with resource providers. You can meet other caregivers, enjoy a really good lunch, and also learn more about becoming a resilient caregiver. And best of all, it's free. So we look forward to seeing you there. This concludes the event today.